Hello, everybody. Welcome back here at SmartEducation podcast. Happy to be your guest here today again. My name is Stan. I'm co-founder at SmartEducation. And as you can see on our podcast channel, on our YouTube channel, we have two amazing teachers here today with us in Leuven. Happy to have you back with us, Benoy Mathew. Joined today with him by Lizzie Marlow for the first time in Belgium. Welcome back. You are our guest for today and tomorrow for the course, Masterclass course on running rehab, how we can bridge the gap between in rehab and really performance. We'll dive into that immediately. First, let me ask, how are you?
Yes, it's great to be back here because the last time I came, we had all the COVID restrictions. So it's good to teach normally, see real human faces, have that interaction with the worries. And obviously, I love being here. The hospitality is unbelievable. And I think I've taught across the world, but I feel like, the organization by Smart is top notch, which is a real pleasure to be.
That was not why I asked you how you are, just but good in general.
Yeah, good. It's all good to be, back and getting that energy from the group. Mm-hmm. So it's definitely a great pleasure to be back.
Yeah. And Lizzie, for you, if I'm correct, it's your first time here in Belgium, maybe even, or you spent here some holidays, but you haven't been teaching here?
No, it's my first time in Belgium, absolutely. And my first time on the Eurostar as well. So that was a great experience. And we went into Leuven, if I pronounced that correctly, last night. And it was really nice. Had some Belgian beer and tasted some of the local food.
One,
so that was
two,
fantastic.
3, or how many?
One. Yeah, only one. Yeah. Wanted to be fresh for today.
We'll have another one later this evening.
Perhaps, yeah.
Good. Well, 2 days of talks, lectures only about running. We have an amazing group, like you said, people who are treating runners all day, every day. So they want to learn a lot from you. For people who weren't able to join us today, maybe we can have you again next year, or we'll see. But if we go through the content a little bit, that's the aim of this podcast, to give them like a snippet, something like that. If I would be a runner, Lizzie, in your clinic, that would be the first question. And I step into your clinic and I have a certain injury somewhere. How would you approach me when it comes to history and clinical assessment? What are the main or the most important stuff that you will look at that can make a difference to bridge that gap where you were talking about? Does it start from the first meeting with a runner?
Yeah, I think it's separated into core stages. So from the first assessment, there are some key priorities to focus on. So the first is establishing a clinical diagnosis, and that's going to depend very much on the history and establishing, a level of index of suspicion about whether or not this is something that needs investigating or referring back to the doctors, or something that can be managed within the session. So screening for red flag pathologies is the first component that we focus on. Yeah. And the main one for runners is, of course, a bone stress injury. And then establishing perhaps some of the risk factors and key drivers for their running related injury. So for us, the key risk factors are previous injury and a sudden change in load. So we spend quite a lot of time discussing screening questions that you might ask the runner within the course. And then we go through a functional movement screen that's specific to the demands of running, establishing any sort of MSK impairments.
And that's
that can
important,
guide.
Isn't it, that it's specific for running?
Yeah, we try to keep it as specific to the movement patterns that are required in running and the range of movement that you need. For example, great toe extension, ankle dorsiflexion, and discussing the importance and relevance of that to the demands of running. And that's really used to guide the rehabilitation process. So that's probably the early rehabilitation process before you get to the performance stage. And we also briefly touch on sort of running analysis and things like that as well.
I also see runners. I've used to see runners a lot in my clinic. What I find every time and again difficult is the load management, how to assess it. Do you have any good tips or tricks for me? How do you do it? Do you use like maybe in this time wearables, information data that you get from that? Or how do you do this in your clinic?
So I think that in our experience, runners classically underreport the amount of load that they do, and no matter how good you are at sort of asking the right questions, sometimes you don't get all of the information you need. So we use a lot of apps, wearables, and things like that to get some of that information about changes in training. I know that you're the gadget man, Benoy, and there's a lot that you actually use yourself.
We'll dive into that later. Yeah. That was one of my questions. Yeah.
So yeah, we definitely use wearables and apps to get some of that information about changes in load. So obviously you've got volume, so running mileage, and you've also got running days and number of rest days, but there's also change in intensity. So we look at external loads, but also internal loads like changes in heart rate, rating of perceived exertion, and also things like wellness scores as well. So, the impact on their sort of stress, fatigue levels, stiffness and soreness that give us a general idea about if they're overtraining.
Yeah. You have anything to add to that, Benoy?
So I think the advent of technology has made it much more easier. So I think nowadays most runners now have stuff like the Garmin watches. So it gives you on the heart rate zone. So you know whether they've been pushing too hard. And also it also gives you an idea of, so I tend to usually give them like a Google Excel sheet or where they tracked on the mile, and I used rate of perceived exertion.
Yes.
So suppose they've been running like 35 minutes or 40 minutes, multiply that by your intensity. So 40 into 7, arbitrary number. So that's better than that. The disadvantage of just looking at miles or speed is you forget the internal training loads. And that's very important because the same workout might feel more harder on a different day. Because maybe you didn't sleep well last night, or you got an exam coming, all that, So the internal load, in fact, is underestimated, and sometimes we can get obsessed with just the external loads. So the combination, as a work from Napier from Canada, where he looked, the combination of both external loads and internal loads is a better marker of that and of the load. And we got work from Tim Gabbett's where he looked into the acute chronic ratio as well. So we don't want to make it too complex, but I think a combination of your external load plus your internal load is generally a good place to start with, because there's a problem of being too dependent on technology and forgetting and not enjoying running anymore. We don't want to give stress by too much numbers as well. But generally, from experience, runners are used to numbers and tracking things like that. So we can use it to our advantage.
Yeah. Okay. One of the things you want to point out in this course is that you want to optimize the return to running process, and that it's based on individual risk factors and also type of injury. Can you give me an example of how this differs when it comes, for example, on type of injury? Do you make different decisions depending on type of injury to optimize that return to running?
Yeah, that's a great point there, because I think, as we know, all injuries are not the same. Like a chronic tendon will be very different from a simple ITB injury. So one of the things which we go highly on our course is look at different aspect of testing. So we look at obviously basic movement analysis and mobility. Then we go to capacity testing. Then we go into strength. And one of the elements which is missed is the plyometric and the power testing. So fortunately now, even if you don't have access to force plates, we've got some good apps here where you can look at the reaction time, counter movement jumps, and there's sort of explosive strength there. And then we can tailor them and say, see, these are the variables. A common mistake runners think is absence of pain doesn't mean end of pathology. So patients, once the pain is gone, if you don't have data to show them, they're not back to full line. So there's a study, I think from Karen and Belakal, where they looked at a group of Achilles tendon. Even after 1 year, only 25% achieved full performance capacity. So a lot of patients...
Same goes for ACL.
So a lot of people, one of the reasons there's a high incidence of re-injury is the rehabilitation is not complete, both from the initial phase to that power phase. So one of my special interest is the power phase. So I spend a lot of time looking into plyometric progression, how to assess for plyometrics. So we go through 6 stages where we look at low impact landing drills, go for sub-maximal concentrates, power output. So there's generally you see the prescription on plyometrics is not great. So I try to make it a bit more easier for the clinician. So you have a structure when you give the power training. We have good knowledge on strength, but not on the power. So that's where we focus on the day 2.
Yeah. and you don't have access to power plates in your own.
Yeah, one of my colleagues has. We have a sister clinic, but for me, I want something.
Most of us don't have.
Yeah.
So what do you use then?
Yeah. So what we use, so we use the My Jump 2. So we look at definitely I look at counter movement jump and a drop from Carlos drop jump. And one of the key factors I look for is a reaction strength index. So it's a good number. So generally I'm looking for more than 1.5. Basically, to make it simple, it's a ratio between your flight time and contact time. Good runners, the contact time should be less than 0.3 seconds. You're more bouncy. So if you're less stiff, then you're spending more time on the ground, more likely to get injured. So when you have numbers like this, it can be quite powerful to runner to show, see, you're strong, but you're not springy. So then we might need some, mobility drills, some plyometry drills, and then we can retest again. The beauty of testing is you can always retest it, and patients like the challenge to see how they progressed as well. So we can use that data to drive our rehabilitation. And if you say to a patient, you need to come for another 2 months, 3 months, having data is powerful because they're more likely to follow your rehabilitation.
Something else that you point out is the dynamic core stability. Something else that is very dark. How do you get data about my core? How do you approach that? Maybe Lizzie or?
I think maybe I could start with that. It's a difficult area because nobody agrees the core. Because when I do my hip course there, people have different views. For me, I think it's a more trunk and core, the whole musculature. We are moved away from the historical idea of just the transabs. So things are now more into anti-rotation drills. It's trying to give a good trunk mobility. So a good runner doesn't have too much of vertical oscillation and too much of a sway. So runners are efficient. You don't have excess movement. So you really have a stiff, So stiff excess movement is tiring on the body. So you don't want to be jumping up and down, or you don't want to be swaying like a bamboo. So you want that sort of a good, trunk stability in the core and pelvic alignment. Another thing which is forgotten is the trunk strength influences the position of your pelvis. So if you've got a good trunk, the pelvis will not be controlled. So sometimes, in my opinion, the trunk strength is not emphasized. It's all about the core. You have to look at the whole chain there. So I think we are moved from, so I try to keep it quite simple, is anti-flexion drill, anti-extension drills, anti-rotation. So it's preventing and basically having a good controlled core without excessive movement. So the only place we should move is your hips and your hands, whereas your trunk is pretty much static there, but it's controlling really well. So it's a more dynamic model of, looking at it rather than a pure single muscle. What would you add to that?
Yeah, I just think in the early stages, I work in a clinic where there's not a lot of equipment. So things like timing on front plank, side plank are a good starting point for just looking at global sort of trunk strength and then getting a time for that. And it gives them a good idea of things to work on. But obviously, as things progress, you want to make it more functional, standing positions, running positions.
That would be my next question.
Yeah, but I'm not sure how I would measure that and give them I think it's more just getting a subjective view of looking at them doing those tasks in function.
Well, unfortunately, you told me I missed out on all the fun exercises. I was away for a bit. What could be an interesting and fun exercise for the core stability specific for runners? Do you have a preferred?
So I really like a Palov press, which we did earlier today.
In a split lunge position.
Do you guys use that word to describe it?
Yeah.
So you go into a split lunge and you have a band in this position and you squat and then come out. And you can sort of modify the resistance of the band and how far you stand away from the band to get increased tension. I think that's a really nice way of getting some trunk activation. You're in a slightly more functional sort of split squat position as well. So that's a go-to for me.
And even the hip one where you do the contralateral, loading. So although it's a hip exercise, your core has to work, prevent that side lurching, So you can't really say it's an isolated core or hip. The reality is you're going to get a bit of mixture of both. So I don't really say this is a pure core exercise.
Of course,
so it's going to be a mixture of leg and the trunk as well. But going back to your point, I don't think I've read of any validated single test which will assess core strength, But it's highly popular among.
I was hoping that you would give me one.
But still now I don't think there is one magic test, which will give you that you got weak core. We got good measurement for strength testing and power testing. Unfortunately, we don't have much data.
But it's something that's being missed with a lot of colleagues, I think. That they only focus on the pathology, maybe only on the joint, and they don't look up the chain and they don't ever assess it. So it's important to do that from the beginning. Since it involves, like you said, it has some influence on what's happening down.
I think as physios, certainly in the UK, we're a bit scared of the core because there was this whole shift towards trans abs and core exercises many years ago, probably 20 years ago now. And then that went significantly out of fashion because there was some evidence to refute it. And I think anyone's even scared to mention the word core in physio clinics now. And so it's sort of this area that everyone's, everyone seems to avoid it.
But trunk stability is so important, you know?
But hopefully we'll move back towards trunk stability as a concept.
And most things, as you know, in physio, you've been around, it comes back, you know?
Yeah, it's
a
like
cycle.
A sling that comes back. We talked about plyometrics. How about running drills? And where does it have its place in a rehab program?
Yeah.
What is your opinion? Do you use it right from the start, depending on progression in those exercises, or do you prefer to have it at the end of the rehab?
So the running drill is great because runners love it. It's sort of something you see in a lot of social media. For me, it's a drill to improve form and efficiency. It's a movement-specific pattern. So it sort of sits somewhere between mobility drills or plyometrics. So some of them are low-level plyometrics, but they are not sub-maximal. So, for example, if you are struggling with hip extension, you could do some drills working on that. If you want to encourage high knees, you could do on that. So based on the assessment, you might find a particular movement pattern you want to encourage. So you might give them a drill on that. So I do, going back to your question, I do include them in the early phase of plyometrics. So I feel it goes nicely with the early stage of plyometrics. And when I discharge patient, I try to incorporate that as part of the warm-up. That's more effective than doing static stretches. So you really have a movement pattern, getting the good form, high knee flexion, hip extension drills, having a good cadence on that. So I think it definitely a sport-specific drill, but I don't think I've seen any evidence where it shows it reduces injury. There's some, it can improve movement economy and running efficiency. So that's a good point. If you want to have good economy and efficiency, that definitely has a place. But we don't want to overload it. Having separate. For me, I try to add it to the plyometric drills or to the warm-up.
So that's a tricky part. If you use it too quickly, then it gets maybe you increase the overload sometimes. They're not ready for it. Is that correct?
Yeah, definitely.
Because since it is a kind of a plyometric drill.
Yeah, it's definitely an external load, isn't it? I think it's also a nice way of improving leg stiffness and working on that reduction in ground contact time that prepares them really well for the plyometric drills.
It's a neuromuscular thing, getting your brain involved in the movement pattern. Like golfers do it, they practice on the swing. So it's a similar thing with runners. You're practicing on your form. So it's working on your form, but not necessarily it doesn't have that carryover like strength or anything. But it definitely has a place, and I would many runners like it. So I encourage that as long as they're doing the basics right, So it doesn't replace your strength and plyometrics.
That's
it's a good
important. We'll use that quote, getting the basics right. That's a good one. How about technology? When I came in today, the first thing you showed me was the latest thing you play around with. You use a lot of technology, wearables. Which one of all those things you played with has helped you the most and helped the runner?
So definitely the increase in technology with cadence, that's cadence. There's no change, there's no brainaries. The cadence apps, like you got different metro timer, which I use on my iPhones. So we know that cadence increases a big effect on joint mechanics and loading patterns. So we don't have to have very complex, you can just download an app or you can give an external metronome. So I think that's something where I find is the biggest bang for the buck for both the runner and easy to do as well. And you don't need complex setup for that. Everything can be done on your smartphone. So for me, that's definitely number one. If you let me, the number two would be definitely, I would say, is tracking down on your workload. So most watches like, Garmin, they really tell you what intensity you worked out. And even my watch tells me after a run that you need to recover for 48 hours or 18 hours. It gives a number. So it's getting more encouraging. But the key thing is there's a fine balance between getting informed or getting obsessed, because sometimes it can give you more stress. So you have to balance it. That's why I never look at my sleep, because it stresses me out when it says that you're not slept well. So I ignore the sleep side. So sometimes you have to balance it.
You ignore it?
Because I go for my objective. If I feel good in the morning, I feel refreshed. I feel it's okay, So you go for it sometimes.
When it comes to your runners, you tell them that
definitely sleep.
Runners who sleep more than 8 hours are...
So we got the data, we got from which said less than 7 hours. So we got the data, 7 hours as an average in 2 weeks. Their injury rate is more than 50%. So I think the important point is, I don't see a man or woman in the modern age is going to have perfect sleep every night. You're going to have 1 or 2 bad days. So you have to look at an average. If in average of 14 days, if you have 1 or 2 bad days, it's fine. So we don't want to create this fear that is going to really break down with 1 or 2 bad sleep. In nature, somebody wakes up, you got tender wild animals, so it's normal. So it's an average in 2 weeks. If you have less than 7 hours, that's the thing, isn't it? You don't want to get obsessed with day to day.
I think, emphasizing the average over a 2-week period definitely reduces the anxiety of like 1 poor night's sleep.
Or like a young mom, or you got a kid there. So you don't want that, to create that sort of fear. You can always catch up in the weekend and things like that.
Coming back at technology, maybe even every week or every month, you see a new device that's coming. And I find it difficult to assess which one of those will help me because they are all being marketed very well and they promise a lot. Where do you stand in that? Do you think there is a lot of advantage from maybe the high cost devices, wearables, with regards to the getting the basics right? And
so I think for me, I look at
to use apps and
for me, I look at 2 things. One is there any published data to back that evidence? For example, like the MyJump app, you got some good evidence on the reliability on that. So a lot of devices don't have any reliability studies. They're just done for purely marketing purposes without that. Whereas you get some, devices where
a belt
across, and for
like
tibial shock
analysis,
as well. Tibial shock as well. So again, if there is no data and there's no, good publication in a good journal, I don't really endorse. I only endorse things where I feel it has good validity. And again, it's not replacing your basic advice. The problem is, as therapists, whether you like it or not, technology is going to move. So it's better that we are informed rather than the runner telling us. So we have to always be 1 step ahead.
Of course.
Because the runners are going to Runner's World. They're going to check on the internet.
And they'll ask you about it.
So you need to be ready for that, whether you believe it or not. It's just being current and up to date with the runners so that you feel and you can give your opinion on that. Because they're going to invest on technology, shoes and watches and gadgets. So that's a big deal for runners. So I think we need to acknowledge their concern and try to guide them, which is appropriate for them as well. So I think it definitely is here to stay.
Thank you on those insights. Well, maybe one last question. In an ideal world, which we are not living in at the moment, there wouldn't be any re-injuries. But that world will never reach, I think. In terms of incidentation of different types of injury, which one in your experience, both of you, which one of the injuries you see more reoccurrence of re-injury?
So for me, I think what I'm seeing lately in the last 5 years is more the master athlete. So I'm seeing more the 40 plus runners, male and female. That population is going really high on that. So, and I find with them is there's a big, when you get older, you lose certain mobility like hip extension, you lose calf strength. And I find the strength training becomes more important. So some of the chronic tendon injuries like the proximal hamstring, they can be real, very difficult to get rid of totally. And they get better, they don't fully recover, and they niggle and they flare up, So sometimes the biggest reason, in my opinion, is incomplete rehab and early return to running. So sometimes, you tell the runner is, I can get you better in 4 weeks in a pain level, but to get that, it might take months. Otherwise, he'll keep on coming back,
Well, in my experience, those master runners, they're really passionate about since they've been running a long time, and they want to reach every year again, they want to reach their own personal records, and they feel really bad if they don't reach that goal. And what I see then is in their training, they go too far when it comes to speed and the interval sessions. I asked them to back off a little bit, and you're never going to be that fast anymore. That's like physiology.
And sometimes I see runners
need to accept.
Some runners, I advise them maybe to go into triathlon. So sometimes what happens, the marathon runners, variations as well. They feel like their running time in marathon drops down. They get really upset because they were not as good. But with triathlon, you see people can still be at a good level because the cross-training, it protects them as well. So I find some people make the switch, triathlon, and they can push even in their 60s and 70s. So sometimes it's the mindset, because if you're very competitive male or female, you don't want to be in the loser side. You always be in the top 5 or 10.
Yeah.
So sometimes they need a different mindset, and they'll always be very competitive type, So we have to rechannel their efforts on that. Anything you would say from your injuries?
Well, I think there's a general culture around if they reduce the number of running days a week, it's going to negatively impact on their running performance. And just being able to educate them around if you switch a couple of running days for some strength sessions, actually there's good evidence to say that's not going to negatively impact on your performance.
Even positive effect.
Yeah, potentially there is some evidence, and also it's going to have a really beneficial effect on your musculoskeletal system. So we know that for the master runner, after the age of 45, you lose 8% of your muscle mass every decade, and you can offset that with supplementing some of your running sessions with strength training. So I think it's just around education, isn't it, and getting that message
and accepting
across.
physiology, which can be a tough one.
Like I said, that was a good message. Maybe to finish off this podcast with both of you. Tomorrow we're gonna dive again into that idea of optimizing the return to running process. We look forward to that. And if viewers or listeners are now a little bit interested by this topic, and do you see a lot of runners in your clinic, maybe it's a good idea to hop in next year, maybe when we will invite Lizzie and Benoy again. Thank you for listening. Thank you, Benoy. Thank you, Lizzie, for taking the time to do this interview with us. If you have if you liked this podcast, it would mean a lot to us that you give us a like button, a cuddle, or a review. That would be nice. You can follow us on different all our podcast channels, and we'll be looking forward to having you again in our podcast, maybe for the next time. Thank you very much.
Thank you.
Thank you.
Bye.